At this point, we'd like to open up for questions for the panel. I don't think there's been anything controversial stated today, so I don't know, maybe there won't be any questions. But I'll help moderate them. So there's microphones set up there, and certainly we're going to take about 20 minutes for question and answer. Then we're going to have some break for refreshment. And then the second part of the panel is going to be well, we're going to direct more at certain types of solutions. But does anyone have a question for any of the panelists or a comment? Leave it, please, to about a minute. Yeah.
Yes. I have a question for Sally Pipes. First, I want to thank you for becoming an American citizen. My hat's off to you. And our new health care bill states, as individuals, that we cannot go outside of the government health care law to pay for our own personal services with a doctor. Can they, in Canada, are they allowed to go outside of the healthcare system in Canada and pay for their own private services?
It is illegal in Canada, under the Canada Health Act, to pay for services that are provided under the Canada Health Act, which are most services. For example, LASIK surgery and cosmetic surgery, people pay for that privately, but for anything, it's illegal. Now, it is interesting that in June 2005, the Supreme Court ruled for the province of Quebec only that the ban on private health care and private health insurance was illegal because Canadians are entitled to life, liberty, and the security of the person. Because of the long waiting lists, Quebecers did not have security of the person. Madam Chief Justice Beverly McLaughlin said, access to a waiting list is not access to health care. So we have seen in Canada, in all of the provinces, particularly British Columbia, Alberta, Ontario, the rising up of illegal private clinics that are doing incredibly well. Dr. Brian Day, who's a good friend of mine, former head of the Canadian Medical Association, who had to win the election twice because people at the CMA, the bureaucrats, said a free market guy like this could not have been elected president of the CMA. So there's a lot of that going on. The other thing is that Canadians do have an escape valve. A lot of Canadians come to the United States and pay out of pocket. And I say to you, where will we as Americans go? Where will the best doctors go unless Obamacare is repealed and replaced?
That was my question. Where would we go? And we have no place to go.
Right.
Thank you very much.
Thank you.
I have a very quick comment and a question. I think we all, including doctors, have been successfully addicted to confuse need versus want, because we interchange the need and want. If we want, it becomes our need, and hence somebody is responsible to provide it to us. I will ask Dr. Brooks also in the same vein. I assume you meant, if you didn't, you can say so, that when the freedom of the individual is protected, honored, and cherished, actually in the end, the outcome is far more humane than what we all have seen now.
Yeah, there's no question, but my argument is that that shouldn't be the argument. And this is, again, history, I think, plays out here. Adam Smith made that point. It's easy to remember when The Wealth of Nations was written, because it was written in 1776, so that's easy. He wrote that in 1776. If each one of us acts in our own self-interest, everybody is better off. He made that point, and he's got lots of examples, and he makes it quite eloquently. But he also says, yeah, but we all know that self-interest is not a very, noble thing. Nobility really means self-sacrifice, and he says that. And I think that completely undercuts the argument. It undercuts the argument to say if everybody commits a vice, the addition of all those vices creates virtue. I think that's a dangerous argument and one that has not been successful, and it's wrong. The actual activity of the baker trying to make a living, and to use Adam Smith's example of making a profit of it, is virtuous. Your activities as a doctor and charging money for it and making money for it and providing your customers, your patients, with the best care possible, that in and of itself is virtuous. When Steve Jobs creates an iPhone and makes 60% profit margins on it, that is virtue. Virtue is that act of creation, of being productive, of taking care of self. And by the way, yes, when each of us takes care of ourselves, because of the trader principle, because as we trade, it creates win-win situations, relationships, everybody is indeed better off. And that's why I said, I don't need to argue that there is such a thing as the private healthcare system works. These guys do a much better job than I do at showing what the solutions are than that. So I didn't feel the need to say yes, and if you leave everything alone, it becomes everybody's better off.
John?
Yeah, thank you all for your wonderful comments, and I look forward to the second half today. With regard to the efforts of the federal government and Medicare of containing and controlling and commanding everything, a question and a comment about the fringe, about the margin that's occurring that Art and the other ophthalmologists in the room will recall the issue with regard to intraocular lenses and a reinterpretation of the Medicare law that Congressman Cox, when he was a member of Congress, helped change through the Medicare administration. Is there any hope with regard to escaping all the onerous restrictions on the fringe with upgrades,
Right, okay.
extended discussion, et cetera, et cetera?
Yeah, what, if you don't understand, Dr. Maggiano is pointing out that one of the things about Medicare, what it did is to try and cut costs at price fixed. That is, it said every doctor's service, whether how much time you spend or how good you are at it or what you're doing, it's the same price no matter what. You know, and obviously we know in a real market that doesn't exist. You know, some doctors spend more time or less time. So it eliminates the ability. So that does a lot of negative things. But one of the interesting things in Medicare is, in ophthalmology in particular, there was a new invention that was not part of the Medicare plan. And therefore, actually, doctors and patients can trade unrestricted by Medicare. And so it starts to free up the system. And he was pointing out that, you know, maybe that would, you know, we can attack it by just making things not covered under Medicare and start to get a market. And that ultimately will help be part of the solution, John. But I mean, in the long run, however, I think you know, we actually have a plan that I'll present in the second part of how to transition out of Medicare, how to respect the commitments made and all the people that are caught in it, but how to basically, I don't want my children to have a socialized, single-payer, rationed plan. I mean, you know, they gave that, you know, they promised that in '65. AMA told them that's what would happen to it. That's what has happened to it. It's going to go bankrupt. Why do we want to continue that for our children and grandchildren? We don't. And so that's one of the motivations why I'm here, is that we do need a comprehensive plan that shows us exactly how to get out of it. And that's what we'll be producing.
I just wanted to add one point. I mean, people don't realize this, but when Medicare and Medicaid came into being in 1965, the first year it cost $3 billion. The precursor to the Congressional Budget Office, the estimates were that by 1990, Medicare would cost $12 billion a year. Does anyone know what Medicare actually cost in 1990? $110 billion. So when even people that debate me from the other side, David Himmelstein at Harvard, Paul Krugman, who I've debated a few times, I mean, these numbers, that 2.5 trillion, 940 billion, they are way off the mark. These government people, when people think something is free, as I said earlier, they demand a lot more of it. And this Affordable Care Act is going to be very, very expensive. And we will have rationed care, just like in Italy and Canada and England.
Thank you, Sally. Go ahead.
Yeah, my question first, thanks for being here. I'm an insurance broker, health insurance broker, have been for 52 years. I'm familiar. My question is, I've been wanting to ask it for a long time, how do we do business, or how do we deal with liars? Everything I hear from the Democratic Party is lying, lying. So from a I know how I'm doing it as an insurance broker with my clients. But you, professional people, how would you recommend? Maybe it's the doctor there, the economist. It's a moral issue. How do we do business and win our point when we have to rebut lies constantly?
I think you have to rebut them. I think that most of the American people are not liars. The American people are open to the truth. They're open to the right ideas. And you just have to go up there and do it. I mean, Sally debates Krugman, talk about a liar. But you have to debate Krugman. That's the point. You have to engage with them, and you have to have the answers. So you have to have the facts, and we need to have all the facts lined up. You have to have a moral and political argument, and you have to bring it to the courtroom. And the courtroom is the American people. It's, you know, you're never going to convince Krugman. It's not about changing Krugman's mind. It's about changing the audience's mind. And the only way to do that is, again, by having the facts and by having the kind of the moral certainty and not giving them the moral high ground. Too often, we give the other side the moral high ground. We need to take it, but of course we need to know what it is first.
Just a quick point on one of my Krugman debates. I had done my statement on the Canadian healthcare system, the long waiting lists, and he was just visibly making faces to the audience. And so when John Donovan from ABC News, who was the moderator, was asked by Krugman, I need to ask the audience a question. If I'd asked that, he probably would have said no. But anyway, he gave Krugman the ability to ask the question. So Krugman said to the audience, how many people in this audience of 450 people in New York are Canadian? 7 people put up their hands. He said, well, how many of you like the Canadian healthcare system? No one put up their hand. So it was a great victory over Krugman. He kind of went like this. He's sort of a troll anyway. And he's like, So, you know, we have to be able to tell the truth. We have to refute lies.
Absolutely.
Because, as Milton Friedman said, when Steffi Woolhandler said she couldn't, I'd given a presentation on Democracy Now!, and then she went nuts. She said, Sally Pipe's a crackpot, relies on crackpot statistics, works for a crackpot institution. I just carried on with my message because Milton said when people do that, they can't refute what you're saying. We just have to be resolute.
Yes, thank you, Sarah. Over there.
Hi. I actually was really pleasantly surprised about what you told me about the Canadian system and Italian system, because I was 20 years old when I lived in the Soviet Union, and I saw that people were basically dying unless they paid cash to a doctor, and you know the surgery was done better, and they had medications. So I left there. You know, I was in pre-med, and I did my MD and PhD in the United States. So, but I saw the same thing in the Soviet Union. So I was thinking all along the way, and I'm very happy that Mr. Brook talked about the moral decision that you have to make, because everything flows from that. So I was curious, in the United States the system is obviously better because people that would die in other countries live here when they're older. And my father just died, and I know that. But I just wanted to ask you, at this point we don't have an even playing ground. We don't have sheep who basically live happily together and, you know, graze on the grass, and everybody has their own individual life. You know, we have CEO of a large healthcare company making $1.4 billion a year in salary per year. We have one large bank manipulating oil prices that everybody pays. We have, you know, we used to have one phone company. Thank God we have more. But how do you temper? Because the decision of everybody having their own individual life is probably the right moral one for me. But I don't know how to make it exist and make it function in a situation when there's so many big wolves among the sheep who basically consume as much as they want. They can eat anybody. The government being the biggest one, but...
Okay, I think we have the point.
Let me just, before I answer that, I think it's kind of interesting that we've got 3 immigrants here on the panel. So we've got Canada, Italy, and Israel, all from countries of socialized medicine. All countries that have attempted to get rid of wolves, and what do? They just create bigger and meaner ones. I could refute every one of the examples you made, and you know the bank that controls oil prices, which is one of the greatest myths in our economy, or even the insurance company guy, who might, you know, if he was functioning in a free market, I would defend the 1.4 billion. I don't know, given the mixed nature of the insurance. But the essential point is this. Socialism, the biggest victims, this is a point Ayn Rand made, I think, very effectively. The biggest victims of socialism, the biggest victims of control and the attempt to equate are the ambitious poor. They are the people who don't now have a chance to rise up from poverty. They are the people who don't have a chance to have choices. You know, rich people, really rich people, the guy with the 1.4 billion, he'll fly to Thailand to get health care afterwards. You know, medical tourism is going to flourish under Obamacare. The very rich are going to do fine. The people who are the real victims here are the people who would get phenomenal health care under freedom. The poor, the middle class, they would get phenomenal health care. And their healthcare system, just like today, you can buy an unbelievable computer for under $500 for poor people, right? You can buy a whole gamut of things. So freedom empowers the middle class and the poor people. It emboldens them. It provides them with choices. This is not an elitist philosophy or an elitist solution that we're proposing. This is actually the opposite. You know, my father was a physician under socialized medicine in Israel. And he would regularly get calls from either wealthy people or people well connected into the political thing asking to be moved forward on the list, right? It's called, in Israel, there's a word for it. It's called protectia, those of you who know, protection money, right? It's a way to pull yourself forward. So if you're rich, you get pushed forward. If you're politically connected, you get pushed forward. And if you're a doctor who won't accept those bribes, which my father was, you get penalized by the healthcare system because the guy talks to the head of the hospital and you get penalized. You know, it is a system of pull. It is a system, this economy we live under and that we're heading towards is a system of gang warfare. It's a system of who can have the most pull with government. And again, government is force, so it's a system of force. Capitalism, freedom, is a system of voluntary choices, and there are many, many, many of them under capitalism. Again, we can get into economics, but it is a fallacy to assume that capitalism is a system of monopoly. It's quite the opposite.
Thank you, Yaron. And Yuri, just to simply say, obviously going into economics is not, we're talking about medicine, but the fundamental principles are the same. And the way I resolve the issue, you're worried about who makes $1 billion and who makes this. The main thing is that you have proper systems that, you know, confront fraud. I mean, you have the ability to contract with people. And I'm not going to know what the best way to make a cell phone company is or anything else, but I know if people are free to do that and we have a proper system that protects contracts, we'll be able to do it. And I believe, obviously, 99% of people are honest. But in a political pull system, it's that 1 or 2 or 4% that actually make out better. So, next one.
Thank you. Great job, panel. Thank you, all of you. This is to Dr. Brook. I have a concern that as you expand the benefits and all the add to the roles of these benefits, how do you derail that? Because you end up with a larger block of people who support this type of socialized medicine, and it keeps increasing as you increase the roles. I know it's great to have these kind of panels, sure, but they're small in relation to the amount of benefits that are being expanded.
You know, the Wall Street Journal just reported a number that's pretty astonishing. I think it was a week or two ago. They reported that 51% of Americans don't pay taxes. So they are net beneficiaries of government services. 51%. There was a time when it was under, and it just crossed over the 50% benchmark. I don't really think that's the problem, because I think that what we need to do is educate people that they're worse off for getting the entitlements. It's not like you're getting the best health care you can from Medicare. Private health care would provide you with better. And again, welfare, the biggest victim, read Thomas Sowell, the biggest victims of welfare are the welfare recipients. They're the victims. I mean, we're victims too because we have to pay for it, but they're even bigger victims because they don't have a life. They don't, because it institutionalizes them into welfare. We should be going to them and telling them that. And you could argue it and you could convince them, because the more honest, the better ones will get it. So I think it's a fallacy, and I think, unfortunately, Republicans give in on this issue. You know, I think Republicans or pro-free market people need to go to the poor, need to go to the recipients of these benefits and tell them that they're worse off for it, and that they would be better human beings, happier human beings, more fulfilled human beings if these entitlements were done away with. So I wouldn't give up just because you've got more people receiving than paying in.
Okay, time for one more question.
Thank you.
But those that had a question, we'll stand around here afterwards, but I want to have everyone have refreshment. You can ask us personally.
I just wanted to share my experience. I'm an expatriate Canadian physician, and I was there when they got rid of balance billing in Ontario, the last bastion of free medicine in Canada. I'm also an expatriate VA physician. I'm an expatriate Medicare physician and an expatriate Medicaid physician. I have been through all these systems. I have nowhere left to run. There are two common themes that to me have run through everything that I've tried to walk away from, and I didn't do this for my particular self-interest, although my self-interest always does come first, because my patients benefit when I'm okay. But I did it for my patients, because what's good for my patients is what's good for me. And ultimately, the themes that have run through all of these systems that I have tried to run away from that are bad for my patients are that they all vilify, they devalue, they demonize and minimize the value of physicians and healthcare providers. It is a key element of what it is that they have to do. If they don't do that, they can't get away with what they do. We become employees, we become not important in society. And what we do, we are the most educated people in all of society. We have more education than even the lawyers that come after us. And ultimately, that is what they take away. We are nothing. We become employees who punch a card, who do a job, and we can be replaced. And what they do and what they've done in Canada is basically the Canadian physicians who have wanted to go to medical school don't go. What do? We go to foreign graduates from lesser medical schools and get lesser doctors who are happy to work for nominal salaries because the money they get is better than what they would get in India or other third world countries. Not that India is quite third world, but the other thing that they have to do is shield the costs. Constantly, none of my patients are aware of anything in terms of what health care costs. They have no clue because they don't pay for it. Sadly, none of my colleagues know what things cost. Do you need an MRI for a headache? Sure, why not? Do you know what it costs? No, the insurance will pay for it. That's a serious problem. And as long as the costs are shielded, as long as we have third parties who constantly interfere with the knowledge of what it is that we do, the knowledge of what patients need to have, we cannot get the system corrected. And those are the elements that they've imposed upon us.
Okay.
So when we become nothing, when the costs become nothing, then it's easy for government to come and say, but we know better. And that's what happens, and that's what's happening here. Thank you.
I'll just quickly add that you're right. We have a first dollar payment system, and that's why what Art said, we have to get rid of, you know, the people who have employer-based coverage get this tax advantage. People who are individuals have to buy their health care with after-tax dollars. Ultimately, I would like to see, you know, it move away from employer-based coverage because people have no idea. If they pay a copay of $20, they think that's what it costs, or $10. And if they pay a little bit of premium, they think that's what, they have no idea. And transparency will only come when we break this down. Also, you're right, in Canada, doctors are really union members. They work for the provincial government in the province that they live in. My cousin's a corneal transplant specialist in Vancouver. He closes up his practice in late November because his global budget for doing what he does is over. This is no way to encourage smart young people to go into medicine. So the brightest and the best in this country will no longer go into medicine. And you're right, Canada has what they call IMGs. It's cheaper to bring in an international medical graduate, and they're not from the United States, into Canada, and it's cheaper, and so that's what they do. We do not want that to happen. I mean, if worst case, we can have the Liberty ships, and we'll all get our health care offshore.
Right.
Where?
Thank you. A couple quick housekeeping notes, and then we're going to get some refreshments, and we should meet back at 4. But I do want you to visit the tables out front. If you're going to leave in between, there's a medical freedom ambassador form I'd like everyone to fill out, and I'll explain at the beginning of the next talk what we're going to do about that and how you can take the ideas here and actually act on them. Okay.